Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's May 2023 issue. There are 3 articles that have been selected as our Editor's Choice or Highlights articles this month. The Editor's Choice this month is an original article entitled, Are Migraine and Vasomotor Symptoms Linked? It is authored by Dr. Stephanie Forbian and colleagues from Mayo Clinic in Jacksonville, Florida, Rochester, Minnesota, and Scottsdale, Arizona. Menopausal symptoms and its vasomotor symptoms component occur in more than 75% of women during the transition through menopause. Such symptoms can be frequent, protracted, refractory to management, distressing, and incapacitating. Forbian et al. Queried whether an association exists between vasomotor symptoms and migraine for the following reason. Vascular dysregulation may contribute to vasomotor symptoms, and migraine, a condition with significantly increased female prevalence, is linked to certain vascular diseases. These investigators employed the data registry on the experience of aging, menopause, and sexuality, the DREAMS registry. These data were obtained from questionnaires completed by midlife women presenting for menopausal and sexual health consultation at Mayo Clinic sites in Minnesota, Arizona, and Florida from May 2015 through January 2022. Vasomotor symptoms were evaluated using the menopause rating scale. Based on this study involving more than 5,500 women with a mean age of 53 years and the majority postmenopausal and white, a history of migraine was present in almost 25% of the study population. In analyses adjusted for relevant demographics and characteristics, women with symptoms of very severe hot flashes, compared with those without hot flashes, more commonly had a history of migraine. Interestingly, women with symptoms of very severe hot flashes were not more likely to experience low back pain, findings suggestive that women with very severe hot flashes may not be more broadly prone to pain syndromes. Importantly, on multivariate analysis, women with migraine in this study were more likely to be hypertensive. In discussing their findings, the authors point out that the linkage between migraine and vasomotor symptoms may reflect the downstream effects of fluctuations or decrements in estrogen levels. For example, the activity of specific neurons in the hypothalamus is implicated in vasomotor symptoms, and such neuronal activity is suppressed by estrogens. Decreased estrogen levels promote such neuronal activity and thus vasomotor symptoms. The hypothalamus is also implicated in the pathogenesis of migraine through certain signaling systems. How these systems are influenced by estrogens remains to be defined. Also relevant is the basis for the linkage between migraine and hypertension, as either disease may originate, as the authors suggest, from shared processes such as alterations in vascular behavior, neural behavior, and the renin-angiotensin system. Moreover, hypertension is an established risk factor for cardiovascular disease, a disease that's more likely to develop in women with vasomotor symptoms. On the basis of their findings, the authors underscore 2 salient take-home messages, among others. First, females with migraine should be counseled regarding their increased risk of vasomotor symptoms during menopause and accordingly proactively managed. And second, given the implications of this triad, migraine, vasomotor symptoms, hypertension, in predisposing to cardiovascular disease, a key management strategy should endeavor to broadly and effectively reduce recognized risk factors for cardiovascular disease in this patient population. Our first highlight this month is an original article entitled Racial and Gender Differences in Medical Student Burnout, a 2021 national survey. It is authored by Dr. Logan Briggs from Mayo Clinic in Phoenix, Arizona, and colleagues from several national medical schools and institutions. Burnout in physicians is a national crisis that compromises physician well-being and patient care. There are at least 3 reasons for assessing burnout in medical students. First, the occurrence of this phenomenon in medical students would be both puzzling and concerning. Getting into medical school is such a competitive and arduous process that one would have thought that the relief and exhilaration of being accepted into and then experiencing medical school would surmount any such risks of burnout. Second, understanding the scope and underpinnings of this phenomenon will hopefully lead to strategies and processes in medical school that mitigate its occurrence. And third, the occurrence of burnout in medical school may be a harbinger for burnout later in one's medical career. Briggs et al. Surveyed more than 1,100 medical students at 9 medical schools from December 27, 2020 through January 17, 2021. Burnout was assessed by the 2-item MASLAC burnout inventory. In addition to demographic characteristics, the survey also obtained information pertaining to potential factors that may predispose to burnout. The data demonstrate that a staggering number of students, 75.6%, fulfill the criteria for burnout as evidenced by high scores for emotional exhaustion and/or depersonalization, with 46% of medical students scoring high on both emotional exhaustion and depersonalization. Burnout was more prevalent in women compared with men, but comparably prevalent among the races, white, black, and Asian. Among the salient stressors that students generally identified as underlying burnout were sleep deprivation, less involvement with hobbies, less self-care, endeavoring to maintain good grades, less connected with social networks, and insufficient regular exercise. The influence of these stressors variably affected female compared with male medical students, and medical students depending on their race. Briggs et al. Provide an illuminating discussion of their findings, which culminates in their call to action whereby medical schools may address and mitigate these stressors. There is something intrinsically lamentable that burnout already afflicts even those at the beginning of their journey towards a physician career, what may be expected to be filled with joy and hope, and a journey which they have chosen in general for the right and altruistic reasons. Briggs et al. Are to be commended for their timely evaluation of burnout in medical students and for offering specific recommendations that may mitigate and/or prevent this regrettable phenomenon. Our second highlight this month is an original article entitled Increasing Incidence and Decreasing Mortality of Cutaneous Melanoma in Middle-Aged Adults, an epidemiologic study in Olmsted County, Minnesota. It is authored by Dr. Elliot Campbell and colleagues from Mayo Clinic in Rochester, Minnesota. Melanoma is the most worrisome of all cutaneous cancers because of its propensity to spread. Campbell et al. Evaluated the incidence and mortality of cutaneous melanoma in middle-aged adults, 40 to 60 years old, diagnosed between January 1, 1970 and December 31, 2020. These authors employed the Rochester Epidemiology Project, the medical records linkage system that gathers such records for residents in Olmsted County, Rochester, Minnesota, who obtain their medical care at Mayo Clinic and other area medical centers. In analyses involving 858 patients, the age-adjusted and sex-adjusted incidence rates increased 52-fold for women between an earlier period, 1970 to 1979, and a later period, 2011 to 2020, while for men, such incidence rates increase more than sixfold. Analyses undertaken in more recent years, 2015 to 2020, compared with an earlier period, 2005-2009, demonstrate that incidence rates continue to rise in women but plateaued in men. In more recent years, the risk of death due to melanoma decreased for either sex. In discussing their findings, the authors considered whether overdiagnosis of melanoma, a possibility suggested for the rising incidence of melanoma observed by others, may be relevant to the observed incidence rates. As Campbell et al. Point out, it seems unlikely that overdiagnosis per se can explain the markedly different temporal profiles for incidence rates in men and women, especially as, in more recent years, incidence rates in men plateaued while increasing incidence rates in women were maintained. It is also possible that screening for skin cancer is more commonly undertaken in women compared with men. While such an explanation, as yet unproven, may underlie the observed findings in general and accommodate overdiagnosis as a possibility, the authors tellingly note that screening in women at increasingly greater rates would need to be sustained for each year during the last 15 years. Finally, Campbell et al. Point out other considerations that merit further study include increased use of tanning beds by women, menopausal effects, and the effects of hormonal therapy. The decline in mortality from melanoma, as observed in this study, is an encouraging aspect of the evolving epidemiology of melanoma and likely reflects the combined salutary effects of emphasis on screening, novel medical therapies, and improved surgical management. You can access these highlights and editor's choice articles free of charge during the entire month of May. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org, where you'll find links to our social media by clicking the buttons at the bottom of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights and our MCP 60 seconds video article synopses. Our website also includes our Mayo Clinic Proceedings issue summary and Author Insight podcast recordings, which are available from our website on our home page as well as through iTunes. You'll also find our online-only features and many news stories posted in the News from the Editor carousel at our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content as well as articles published online in press. As always, we greatly thank you for your interest in and support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.